thank you, Alderman Murphy, for, again, your leadership in our city and particularly this district where we're hosting today's event. As I mentioned earlier, infant mortality is a complex and a multifaceted public health concern. A combined community effort and the utilization of intensive home visitation can begin to chip away at this concern. Research and evaluation has led us to some positive changes in this area. We found that if we take some of the best practices and deploy them, that we can get some good outcomes. Sadly, every year about 125 babies in Milwaukee die before the first year of life. But in 2007, we saw only 111 such deaths. And this was a significant drop from 2006, as the mayor mentioned, when we had a high of over 140 infant deaths. This decline has been attributed to a reduction in prematurity. And prematurity just happens to be the #1 killer of newborns. Babies born prematurely are going to have less developed organs than full-term babies. They're more likely to face significant, multiple health problems following delivery. And these lifelong problems, like cerebral palsy, mental retardation, chronic lung disease, and vision and hearing loss, are some of the things that impact these babies. Despite the drop in 2007, the number of infants who died after being, from prematurity, who died after being placed in unsafe environments actually did go up, about 15% between 2006 and 2007. So while we're making progress in the area of prematurity, unsafe sleep environments are still a big concern. And that's why the Pack and Play, the work of St. Joseph, is so critical, because it will help us chip away at that. To all the men and women in the Milwaukee Health Department, we understand that this is something that we have to work on daily, driving home the need for safe sleeping practices, and to promote to parents the need not to co-sleep with infants. And based on all of the policies that we have from the American Society, American Academy of Pediatrics, and other concerns, that we want to reduce the risk of SIDS in our community. So sleep environment is important. About 2 years ago, the health department implemented 2 comprehensive evidence-based home visitation programs that we see as the wave of the future and a necessity of the future. One of these programs, Empowering Families in Milwaukee, was aimed at improving birth outcomes and enhancing family functioning and supporting this child's safety that I've talked about, and preventing neglect and abuse within or among children. It targeted many of our high-risk neighborhoods, same ones that have concerns about teen pregnancy or housing or crime, and we're happy to be in those same zip codes. And to date, we've seen over nearly 350 patient clients and have over 13,000 intensive home visits. And we're pleased today to have with us, and you've already heard from Max, who's inspired, but his mother, Candelaria, they are participants within our program, and that is an outcome. You're seeing, and you're hearing through Max, a program that actually works, that breathes life into these rates that we're seeing a drop. We've also seen families through the Nurse Family Partnership. Mayor Barrett referenced earlier that our partnership with the Columbia St. Mary's Health System has made that possible, along with the University of Wisconsin Partnership Grant. There we are also conducting intensive home visitation, and there we've seen nearly 80 clients and done over 1,300 home visits, and we've seen babies born, about 91% of babies born have adequate birth weight and have been full term and not premature. So we see some success there. But I want to underscore that this is a community-wide effort, and we have some partners who have been on the ground for many years. The Black Health Coalition and their Healthy Beginnings and FEMA program has been joined with the health department and many others for many years. There are a lot of other partnerships that are happening from community agencies. The state has put money on the ground in terms of healthy birth outcomes, and they're eliminating birth disparities project over the last 3 years, and that has been a part of this community effort to make things happen. So the health department is one significant part of the puzzle to address infant mortality rates throughout the city. And while I'm troubled, just as the mayor said, by all deaths, I'm particularly troubled by infant deaths. And we focus on this disparity between black and white, that gap. That gap is shrinking. And when we look at the statistics, we're seeing the number of African American babies that die go down in our community, and that's a key concern. I'm encouraged by the resources in our city, and one resource is located right here at Wheaton Franciscan St. Joseph. And they've been extremely instrumental in helping parents obtain those critical sleeping environments for children. And joining us today is one of those practitioners, one of those clinicians who are on the front line, and she's a pediatric nurse educator with the hospital. And I'm pleased to invite to the podium Kathy Oates.
Thank you and good afternoon. As you've heard, we have a challenge before us. We are extremely pleased by the decrease in the amount of infant deaths related to a decrease in our rates of prematurity. However, we are taking time and multiple resources to make sure that these babies are surviving and doing very well. And then we're finding that they are going home, and sometimes families do not have the resources to supply a safe place for a baby to sleep at night. We know that adult beds are not the place for babies to be, and neither are couches, recliners.